today we're going to study integrative physiology topic, that is physiology of aging. So this topic is not a very core competency. It comes into a must-known competency, but definitely you will have to know the concept at least in the form of short note, right? So let us proceed. Okay, who is she? Since we are beginning with aging, come on. Anybody? Yes? Okay. Next. She is 105-year-old Japanese sprinter, Hedichiki, who broke the world record being oldest sprinter. So what I want to tell you that aging is not a disease. It is a process. Like as we evolve from fetus to a neonate to a postnatal life, you go into your puberty, adulthood, adolescence, you become middle age, and slowly you're going to decline towards your old age. So it is a natural physiological process, but definitely with some declinement in the functions. Now let's just look upon to a very interesting story and make aging a very interesting topic. These three were supposed to be very bitter women. So this is a painting which is formed by a Greek painter, which is based on the Greek mythology. So there were three bitter women. These bitter women were Klothos, Atropos, and Laches. And these were supposed to weave the thread of life of human beings. Matlab what? Clotho was something who used to decide that whether I'm going to give this person life or death, right? Second one was Laches. This Laches was one who used to decide how long the person would live. What is the longevity? Kitna lamba he is going to survive. And Atropos decided the fate of death. How that person is going to die. And you see, when you are living, you have got a particular age, you have got the quality of life, and you also have the quality of death. You see some of the people, how do they die? With ailments and morbidity. And some of them are fit till the last day. And achanak you find that they are no more. So this was not only an ancient story, now this has been proved in the biological medicine as anti-aging proteins, which is Klotho, a very, very important anti-aging protein. And this Klotho is supposed to act through active form of vitamin D, that is 1,25-dihydroxycholecalciferol. So it increases probably the calcium and the phosphate metabolism, increases their receptors, also modulates your immunity by increasing fibroblast growth factor 23. So you have got clothoprotein, which is the anti-aging protein, fibroblast growth factor, that is the Laches of the Greek mythological story, and vitamin D as the Atropos, which have been now styled as the sisters of fate. Isn't it interesting that though we are studying now, this was designed long back. Now, aging can physiologically be defined as a time-related deterioration in the physiological functions, those physiological functions which are necessary for survival and fertility. See, the word fertility is very, very important because the reproductive functions are going to decline. That actually defines the old age. It is the science of aging, which is referred to as gerontology. The scientists who are studying for the science of aging are called gerontologists. and it is a specialized branch of medicine that is dealing with the old age problems, which you called as geriatric medicine. So you might have heard this word, geriatric medicine. So it is a specialized branch. That means after somebody doing MD medicine can specially go towards geriatric medicine. Okay. Next. So there are age-related changes in physiology as far as your old age is concerned. So we'll try to enumerate them system-wise. As far as your cardiovascular functions are concerned, you will see that the myocardium shows deposition of a yellowish pigment that is called as lipofuscin. You will get degenerative changes in myofibrils, mitochondria, fibrotic lesions, amyloid deposits, capillary density may decrease, and vascular valves may show thickening and structural changes. Apart from this, the resting heart rate is unchanged. But obviously, while performing exercise, maximum heart rate cannot be achieved. What is maximum heart rate? It is 220 minus age, right? So 220 minus age is the maximum heart rate I can achieve when I'm exercising. With age, you are not able to reach to that figure. Very important, maximum cardiac output increase, which is there, will also decline after the age of 40. Blood vessels, they show very important changes, like number decrease in the elastic fibers, characteristics of elastic tissue. You remember you do your pulse practical? Don't we tell you to feel the pulse? Whether the pulse is, the artery is soft and non-palpable or whether it is palpable. And we usually say that compare it with that of the old age. So what occurs is the age-related thickening, arteriosclerotic changes because of the decrease in the elasticity. So because of the decrease in the elasticity, what is going to occur in the blood pressure? Systolic blood pressure will rise and diastolic may remain same, it may reduce, and eventually the pulse pressure is going to be widened. So one of the important cause of a widened pulse pressure physiologically is exercise. Second important is old age. Apart from this, decrease in the blood flow to vital organs like heart, kidney may be reduced, even liver. You will get changes in the pulmonary circulation, like increase in the compliance. Have you studied this? Yes. We have studied that one of the important cause of increase in compliance is pathologically emphysema, physiologically aging. What happens with aging? The typical nylon stocking arrangement of the elastic fibers is disturbed. Elasticity is decreased. So there is nothing left to control the stretchability of the lungs and you get increased compliance. The compliance graph will shift up and to the left with aging. That is a normal thing which is going to be there. Pulmonary blood vessels can also show age-related changes. FRC can increase, residual volume can increase because the compliance is increasing. Therefore, FRC and residual volume are getting increased. GIT. So you see many of the old person, doesn't their appetite reduce? Yes or no? Appetite reduces. Taste reduces. You will find many of the postmenopausal women, namak kam, namak zyada, that means their taste perceptions are altered. The amount of food they can eat before 40 is not the same after 40. They reduce in their eating behavior also. They may have difficulty in swallowing. They may have dysphagia because of the weakness of the muscles. Very importantly is the reduction in the gastric secretions that is called as aclohydria, which is very common in age group, especially above 60. Apart from this, decrease in the microvilli, decrease in the surface area. So the absorptive capacity is decreased. Colon motility may also be decreased in the old age, especially if old age is along with diabetes, they may develop neuropathy. So in that case, constipation may be exaggerated. Now, Now, renal and genitourinary changes are again important. Decrease GFR, because you yourself have studied the number of nephrons, they start declining after 40. Decrease in the tubular functions, that will be both a decrease in the reabsorptive and the secretory functions. Their decreased ability to concentrate and dilute urine. You see, many of the old people, they minimize their intake of beverages like tea and coffee because they want to avoid going to nature's call. So that is very, very significant effect. Prostate enlargement in the males is very, very important feature. After 40 it may start, and it is one of the important cause of increase in the residual urine volume in males. Females, on the other hand, may suffer from vaginal urethral mucosal atrophy because of the decreased availability of estrogens. You know, estrogens, they bring about a protective conified vaginal epithelium. And as postmenopausal, when the estrogen and the progesterone levels are reduced, the vagina will become same as infantile, more susceptible to infections. Endocrine system, one of the important thing is the decreased responsiveness of the existing hormones to the target cells. Either there could be a decrease in the number of receptors, or the hormone response to the receptor may decrease, right? So this can itself result in either decreased action or decreased secretion of the hormones. Next. Yes. Thyroid hormones are hampered. Many of the patients in the old age can also come you with hypothyroidism. Impaired glucose is a very, very important thing because of the decrease in the responsiveness of the target tissues to insulin. Remember, the important target tissues are skeletal muscles, adipose tissue and liver. Reproductive hormones show a very, very important change. Isn't it? What happens in females? Estrogens, progesterones decline, and because of this, the LH, FSH levels may raise because of the loss of the negative feedback mechanism, and the females, they suffer from something very important which we call as the postmenopausal syndrome. Antidiuretic hormone, renin, aldosterone levels are decreased. So diuresis this is related to diuresis. Apart from this, remember, their response to stress will also be reduced. Vitamin D absorption, activation is reduced. So you will see in old age, what is happening in the postmenopausal women, even if you are giving calcium supplements, it is of no much use. Isn't it? Because the calcium reabsorption is hampered. So you either have to give it active vitamin D ke saath mein, or you will have to give estrogen supplements so that vitamin D absorption can be increased. Very important will be also the blood and the immune mechanisms. They keep on decreasing because you know, you have studied hematology. What happens is progressively the red marrow, it gets replaced by yellow marrow. So that is going to bring about a decrease in the hematopoietic reserve. Anemia is important. One of the important causes of anemia could be decreased intake, decreased absorption. So remember both of these. So old age people coming to you with more of calf pains, especially on vegetarian diets, always keep in your mind as an Indian medical graduate, think of vitamin B12. You know this, you have studied in the first year that vitamin B12 deficiency is common, isn't it? So one of the simple reason of calf pains could be vitamin B12 deficiency. Senile purpura is very common. If you see old age people, they should show you hemorrhagic spots on their hands and legs, which is not very, very pathological. But then you should be able to correlate that this is not pathological. This is simple senile purpura. Immunological functions are depressed. So we saw in COVID, what did we see? That old age people were more susceptible to COVID. Old age people were having more complications of COVID. Recovery was poor. Immunity is suppressed. Muscular power, muscle strength is reduced. देखा होगा आपने, muscle mass, the lean body mass is decreased in old age. Osteoarthritis, it starts after the age of 40. osteoporosis, a very, very characteristic decrease in the bone density, and females are more susceptible to this. Now, important changes by which we diagnose that this is aging is especially our physical appearance, isn't it? The moment a female will start getting wrinkles, so she will get bothered and she will think of all the cosmetics she can apply. But remember, they are of no use because it is from within the body. Actually, the process has started. There is a decrease in the elasticity. There is thinning of the skin, the epidermis, dermis, and the loss of subcutaneous fat is a hallmark of aging. Have you seen the skin of old people? It becomes very thin. They do not have much muscle mass. The total body water content is also reduced in old age. Graying of hair because of the decrease in the melanin pigmentation. Increase in the facial growth, which is more common in females because of the androgens will be there. Sweat glands, they also decrease in size and number, so reduced sweating can be there in old age. Now, central nervous system is also much affected. You know that CNS is mainly dealing with lots of neurotransmitters. So basically, one of the important things will not only be the atrophy of the cortex or the cerebellum, but an important thing will be a decrease in the neurotransmitters. So can we remember Parkinson's, Alzheimer's? Common diseases because of the decrease or an age-related decrease in neurotransmitters. So degenerative changes, decrease in the neurotransmitter in quantity as well as the functions are reduced, reflexes, they become sluggish, and sleep decreases. The duration of the REM sleep is going to be significantly reduced in old age. Have you seen old people? You might have your grandmothers, grandparents at home. They sleep less. So either they will bore you at night or early morning to wake you up also because they have reduced sleep and REM significantly decreases. Next. Age-related changes in your special senses, presbyopia, that is failure of accommodation to near vision. So what happens if an old person, before 40 he can read like this, but then what he is doing, he's taking the book back. That means the near point is now away. So these are the practical things which you observe, but when you study you can correlate it that this is the process of aging. You might have observed they are not able to thread the needle. Commonest thing. So aging has started. Presbyocusis, isn't it? Decrease in the hearing, sensory neural hearing loss. So sometimes if you say, if your grandmother is calling you and you are answering and she is not replying, so take it that physiologically it is reduced, so you must give her special attention. Next, dryness of eye is also important thing with old age. Taste sensation, as I told you, number of taste receptors they reduce. Maximum taste sensation or taste buds are in the newborn, infants, and gradually over a period of time and towards the old age, the number of taste buds they decline. Otosclerosis can sometimes be there as age-related because of the decrease in the motility of the ear ossicles. Next. Yes. Now, we always consider the physical changes as a part of aging, and we always forget the emotional component of aging. That is something very, very important. As a physiologist, you must take into consideration. As the person is advancing and going to his old age, he is lonely. There was a period where the family was surrounded. Now what happens? Everybody's got their own work. Children are studying, most of them are out of the houses, so the person has become alone, and we know that as we are aging, the hormones are decreasing, immunity is decreasing, and we are more vulnerable to stress. So emotional problems like depression, anxiety, anticipation, fear of death, fear of loneliness, decrease in the sexual activity. Retirement is one of the very, very important factor which any old person may bother about. So why should we look into these status? Why should we consider the economical status also? That means aging does not only mean that how I'm going to plan about my body, but how I'm going to plan about my mind to keep it fresh, how I'm going to plan about my finance. An old person who is alone without money, he will be more depressed. But if he's got a good financial support, if he's got a good planning, his aging would be comfortably much better. So whenever we are writing, whenever we are studying, we must never neglect these important physiological, emotional factors associated with aging. Right? So even you people as students, when you are dealing with old people at home, always remember, apart from the physical, the emotional problems are more bothering. Next. Now, what are the different theories of aging being given? A very, very, accepted one is the programmed senescence theory. This is very simple. This says that as we are growing from childhood to a pubertal to adolescent, adult, likewise, we have got a programmed adult age and an old age, which is many of the times genetically determined also, depending upon your ancestors or upon your parents, how do they age. So that is the programmed senescence theory. Cell replication theory. There are three types of cells in the body. Cells which continuously replicate, like your RBCs, your epidermal cells, GIT cells. Then there are certain cells which will replicate only with stress, like endothelial cells, hepatocytes, and fibroblasts. And there are cells which do not replicate at all, especially your neurons, myocardial, and the skeletal muscle cells. So depending upon the cell replication theory, it is said that the replication of the cell shows a declinement with age. Cross-linking theory, this says that there is accumulation of cross-linked proteins which are going to accelerate the aging process. Now these cross-linked proteins, if they get glycated, that means if the glucose is also getting attached, aging is going to be further accelerated. So diabetics may, jahan pe glucose is uncontrollable, glycosylated hemoglobin is more, the physical changes of aging will be still more premature. Very much accepted, and very much cosmetically being expanded theory is the theory which is based on free radicals, right? You know what are free radicals? We study as a core competency in our biochemistry. So the free radicals are generated by the different reactions going on in the body. These free radicals are scavenged. We've got natural antioxidants present in our body as enzymes. Apart from this, vitamin C and vitamin E. But if the number of the free radicals are more, antioxidants are less, these free radicals, what do they cause? They cause polyunsaturation of peroxidation of the polyunsaturated fatty acids of the lipid membrane, and they are very, very harmful. So based on these concepts, you might have seen that many of the products like antioxidants are now pharmaceutically very much coming up. You will see that drugs are given which are full of antioxidants promoting the anti-aging effects. What do you mean by chronological aging and biological aging? Something again interesting. Now there is a person who is 45, but he looks very young. He looks as if he's 35 to 40. And there is a person who is 35 and looks 50. This can be? Yes. So there are two ages. One is your chronological age. That is as per your birth. You calculate it as per your birth. Second is your biological age. That depends upon your bodily functions. Both of these two are affected and unaffected by certain factors. Like chronological aging cannot be influenced by external factor. Every year you're going to cut your cake and your chronological age will increase. So you cannot reduce that. The number will increase. Body cells age because it is a natural process that as the body is aging, the cells will be aging. Now the person can work, but definitely his efficiency is decreasing. But on the contrary, biological age is influenced by external factors. Lifestyle modifications can definitely make a person who is 50 years by chronological age to be 40 by biological age. Right? So you are, if taking care of your body, the body cells are going to proportionately not increase as per your chronological age. That means their functions are not going to decline. And the person's body is as good as he's taking care of himself. How can you modulate the aging process? Just by thinking that I'm getting old or by doing something. So there are two important factors: caloric restriction and exercise. Now, what do you mean by this caloric restriction? So I'm not saying you that go on diets if you are becoming old. You have to just change your proportion of the plate. Your plate is initially 60% carbohydrates, around 20 to 30% of proteins, 15% is your fats, and then is your fiber. As you age, make your plate colorful. That means increase the content of fibers, fruits, vegetables, proteins, minimize your carbs. That is what is related with free radicals. The more you are consuming starch and sweets, the more you are becoming cross-linked proteins. That much amount of cross-linked proteins are going to accelerate. The more the body is assimilating the food, the more it is generating free radicals. So you are again hampering your body. So one of the best way is caloric restriction in terms of modification of your food plate. Second, very, very important thing is your exercise. Now, I'm not saying you to exercise to any limit. You have to exercise according to what your body permits or what the old age. Suppose there is a person who has never exercised and the moment that he turns around 45, he starts running. Is it possible? No. So you have to start with the type of exercise that is going to suit the person's body. It could be those who are regularly exercising, they can go for any form. But those who have never, always begin with simple exercises, which is not only going to bring about an improvement in the physical ailments, but mental also. You know that when we are exercising, there are important hormones being released, like endorphins are there, there is oxytocin. These hormones themselves are good to elevate your mood and bring more of positivity. Now let's look on to something, which is very much in advance these days. Like as we say, the female notices wrinkles and she gets bothered. So one of the very, very upcoming treatment is called as the Botox treatment. You know what is Botox? Botulinum toxin, are you remembering? Which brings about presynaptic inhibition at the level of NMJ and prevents the release of acetylcholine. So that kind of the Botox drug is given as an injection to reduce the facial wrinkles, the facial lines, creases, and it is one of the widely accepted in routine, in practice, being taken up by dermatologists. Okay? So all the stars which you see are made beautiful. Another important thing is, these days, face upliftment. This is also being done. You can do face upliftment, cheek upliftment, so that the aging effect, especially on the face, if the female is bothered of, can be minimized. Who people are these? Which country? Which country at least? Yes? Yes, Japan. Next. So there is a beautiful place in Japan that is called as Okinawa. And you know that these Okinawa people are the people who have got longest life, specialized longest life, and the life is full of quality. So they're just not leading a morbid life. There is a life which is full of quality. You know, they are actually marked for their good health. They are known to be very much closely related to the core of the nature, discovering and pursuing your Ikagi life. So what is the secret of this? The secret of this people is not only their diet and not only their exercise. They are relieving their stress by social circle. They are actually known to be bonded with more and more people. That means one of the important factor by which we can manage our old age is to minimize the stress. Stress is one of the single most factor accelerating your aging. And you know the stress can be minimized if you share with your peers, which can be done if you have peers. So having friends and spending time with them, sharing with them, getting out of your stress burst is one of the most effective way. So remember in nutshell that we cannot be always young. We are going to have a chronological age, but with our efforts, we can have a control over our biological age. Isn't it? So if we keep on maintaining ourselves in terms of mental health, physical health, emotional health, and financial health, all these factors, so you can really be, or you can really have a beautiful aging, and you can age gracefully. So remember that nobody grows old merely by just adding up numbers to your life. We grow old by deserting our ideals. Years may wrinkle the skin, but to give up enthusiasm wrinkles the soul. So, thank you everyone.